quite common. It can be seen in different age groups, including children, teenagers, also can last up to middle age period and even longer. Acne is caused by blockage of very small glands located on the deeper part of the skin called sebaceous glands. These glands are very close to the hair follicle and they secreting a lubricating material to make the skin softer and also help with growing hair. In certain cases, especially those are prone to acne, these glands are producing a lot of sebum, and that can cause blockage of the glands. Overproduction of sebum by sebaceous glands can be due to imbalance in hormones, genetic factors, and also certain diets. When it happens, the presentation would be from small spots on the skin, some of them with black color on the top and some with a skin color surface. We call them comedones. Acne disease are usually when the inflammation is very superficial and there is a mild swelling of sebaceous glands. Eventually, the lesions might become more inflamed, involving the deeper part of the skin. And on the surface of the skin, we can see they are much bigger and sometimes very red, swollen, and painful. Eventually, this inflammation can end up with a scarring. At this stage, we call it severe acne. Some scarring are very mild, however, some of them can be very disfiguring, and that's why acne needs to be treated. Treatment of acne starts from the patient to make sure the lifestyle is healthy, avoiding too much carbohydrate or significant amount of protein in their diet. Stress can be another trigger for acne, which needs to be managed properly. Certain medication or topicals can cause acne, including topical steroid, like steroid inhalers we use for treating asthma, can trigger acne. These certain products, including foundations which are very thick and solid, can block the sebaceous glands and trigger acne. Apart from that, it's very important to look for other symptoms, especially if you have weight gain recently, if for ladies, menstruation period is not happening regularly, if you have other features like growing coarse hair on your face. These are recommending further investigation to ensure about your hormonal imbalance, which can happen in conditions such as polycystic ovary syndrome. In boys, in contrast to girls, it's very important to ensure they are having very healthy, well-balanced diet. Certain youngsters go to the gym regularly to build up their muscles. And as a part of their program, they have a large intake of protein and sometimes anabolic steroids. The both steroid and high intake of protein can trigger acne and needs to be avoided. Apart from that, stress can be a significant trigger for acne. We see a lot of patients around the time of their GCSE level or before interview, or when they change their life situation, they change their work, and those would be strong stress in their life triggering their acne. So it's very important to have a holistic approach when we are treating acne in different patients. Treating acne is very individualized. We have a guideline to treat acne. However, sticking to the guideline would not be suitable for each individual patient. For example, some patients might not tolerate the topicals we prescribe, or antibiotics might be contraindicated in some other patients. In severe cases of acne, the top priority would be retinoid in form of systemic, such as Accutane or Roaccutane. This medication is not antibiotic and is associated with some side effects which needs to be monitored very regularly, and I'm not gonna go to the details. In other cases located in moderate and mild class of acne, the treatment starts from topicals, and then we can add oral antibiotic, and in addition to that we can use non-prescription treatment options which can be used as an isolated treatment or in combination with topicals and oral antibiotic. In my clinic, we receive a large number of patients. Some of them are ideal case for medical treatment. However, those patients coming with very sensitive skin, or those are not keen to try any antibiotic, or those who have tried a lot of medicine in form of tablet and topicals and are frustrated with any more treatment, we consider the non-medical treatment. My technique to treat acne in such group of patients is combination of microneedling, exosome perfusion, and finish the treatment cycle with photodynamic therapy. What microneedling does is making several hundreds of small microchannels on the skin. So microneedling can end up with opening of already blocked sebaceous glands, and also is a trigger for skin to start the process of repair and rejuvenation. The last but not the least effect of microneedling is opening a small way for the treatment we use during and after the treatment to reach the area we would like the medicine to work, which are sebaceous glands. Sebaceous glands are deep down in the skin, and many medicine we try might not reach them, and microneedling can facilitate the process. Soon after microneedling, we use exosome perfusion. Exosome is naturally produced by each individual cells, and that's the way they communicate each other. However, the exosome they make and transfer to adjacent cell is dictating the next cell to make acne and to behave towards making the problematic skin. We can replace it with external exosome, and that exosome is signaling each individual cell to calm down, especially for the sebaceous glands to be less active and to rejuvenate and repair the skin towards having a healthy, fresh, and young skin surface. Exosome can be used in many areas in dermatology. We have a special exosome for skin, which we use for acne, and at the same time it works on scarring and dyspigmentation of the skin. The last part of the treatment cycle is photodynamic therapy. Photodynamic therapy is using a specific wavelength of light. In our clinic, our device is combination of blue, yellow, and red color. So blue color, which is with the shortest wavelength, is gonna clear the surface of the skin of certain bacterial agents. As you know, there is a specific bacterial agent in acne called Propionibacterium acne, which can be dealt with by blue light of photodynamic therapy. The other two are with much more important role. They penetrate deep down to the skin where the inflammation is sitting, and also where the sebaceous glands are located. They calm down the sebaceous glands, they help to settle down the inflammation, and also they help with rejuvenation and repair of the skin. In fact, photodynamic therapy is one of the options we use to treat scarring as well as inflammation of the skin.